So Dr. Rabin, given the potential benefits of ketamine therapy versus traditional SSRIs, do you believe the treatment standards in psychiatry need to change?
In short, yes, the treatment standards do need to change. I think the major problem with SSRIs and selective serotonin reuptake inhibitors and other antidepressant medicines is that they're overprescribed not just by psychiatrists, they're overprescribed by family medicine docs. Most family medicine docs, their patient population is 50% or more mental health issues. And they're not even trained to do these kinds of complex treatment programs with these folks. And so many of these medicines actually numb us or make us less connected to our sense of self. They numb our negatives, but they also reduce our sensitivity to positive experiences as well. And so the medicine becomes almost like a crutch to just help move people along in their treatment. The book says that if you check these boxes for depression and you meet criteria to try an SSRI, that's the quickest way to move you along and get you out of the office and get you onto a treatment plan without having to take too much time to explain it to you. And I think that the real healing practice comes from within all of us. And so the goal should always be to help guide our clients to be able to understand that they have to do the work. We all have to do the work. We have to do the day-to-day practices to make sure that we are learning how to become the strongest, fullest version of ourselves. And if we just rely on the medicine and think there's going to be a magic pill that's going to do all of that for us, then we're going to wind up disappointed at the end of the day.
I love that everything that you're saying is based on science. And you mentioned that in some instances you would say, as opposed to going with an SSRI, you think ketamine treatment would be better for patients. Are there certain patients where you say, you know what, instead of ketamine, I think an SSRI really is the way to go for you?
Absolutely. There are people that cross all spectrum, and there are also people who I see who are not good candidates for either. So it really has to do with, what have you tried so far, and what has worked for you? How has it worked? And we really do a ton of investigation with each of our clients, particularly when we first meet them, to gather all this information to make and most of my patients, by the way, are what we call treatment-resistant mental illness patients. So this is a really interesting point to make, because the reason why I have fascinated by working with these kinds of folks is because they've tried most things usually by the time they've gotten to me, and it hasn't worked. And so we look at ketamine and wearable technology and other natural approaches that have very low risk to guide people away from feeling completely disempowered to heal themselves. Many people feel like if you don't take the medicine the doctor prescribes you, you're not going to get better. And that's unfortunately what a lot of the studies show as well. But those studies aren't looking at the whole healing process fairly. And so we really need to remember that it's about empowering our clients to take the healing process into their own hands.
Fascinating stuff.